Universal health coverage, or UHC, means that all individuals have access to quality essential health services without suffering financial hardships. Achieving UHC, one of the targets of SDG 3, is a global issue to be tackled. The COVID-19 pandemic brought a renewed awareness of the need for more resilient health systems and greater preparedness for public health crises. The increase in non-communicable diseases, such as lifestyle diseases, and an aging population have also placed a greater burden on medical and health services, requiring a timely response.
In the world, there is 1 billion people, who have kind of little access to the real basic human need and also health services. That is why universal health coverage is very, very critical. Not only just financial protection, but also physical, cultural, and social kind of access. So UHC is really important, but how is next step.
Recognizing health as an essential basis for development and economic policies, Japan has been contributing to the achievement of UHC through G7 and G20 summits and other initiatives.
In 2000, in Okinawa G8 summit, Japan also tried to enhance that innovative collaboration to fight against HIV, TB, malaria at the time, which was very, very big issue, just beyond that health. But not only just, the saying word, but also providing huge amount of financial support and also technical support through JICA especially.
In May 2022, the government of Japan formulated the Global Health Strategy. It has 2 goals. The first is to contribute to developing resilient global health architecture and strengthening the prevention, preparedness, and response, or PPR, for public health crises. The second is to accelerate the efforts to achieve more resilient, equitable, and sustainable UHC. One of the actions laid out in the strategy is the contribution to international discussions, such as calls for greater coordination among finance and health authorities. At the World Health Organization, Japan has been contributing as the president of Committee A, the technological arm. It will further promote collaboration with international institutions, including the World Bank.
Japan is a leader in global health and has been a key partner for the World Bank over the past decade. Our work closely aligns with Japan's global health strategy and applies comprehensive and people-centered approaches to our collaboration and cross-sectoral challenges. We're grateful for our ongoing partnership and look very much forward to further strengthening and deepening it.
Japan will provide financial contributions and support to public-private partnership funds such as the Global Fund, CEPI, Gavi, UNITAID, and the GHIT Fund.
Over the past 20 years, the health programs supported by the Global Fund Partnership have saved 50 million lives. Proof that global commitment and community leadership can force even the world's deadliest infectious diseases into retreat. Together, Japan and the Global Fund have achieved critical gains in expanding access to health services for the world's most vulnerable and at-risk populations. We hope Japan will continue its leadership in global health by strengthening the political commitment.
Refrigerated vehicles from a Japanese company contributed to the vaccine delivery under COVID-19. Japan will continue to facilitate such private sector contributions to global health. Through bilateral ODA, it has been reinforcing regional health systems and the development of human resources. For example, it implemented a plan to improve a children's hospital in Chennai, southern India.
all specialties are there. The x-rays are there, the labs are there. The patient used to go from one place to the other. Now all the OPs have been brought into one complex so that the patient who enters completes everything except cardiology within the same.
In addition to a new ward, the hospital was provided with medical equipment required for pediatric care, including an ultrasound scanner, artificial respirators, and surgical instruments.
That's very, very advantageous for people who come from different places across the state and outside the state. And the building is looking very aesthetic, and it is very, very patient-friendly, very spacious, aerated. And patients also feel very comfortable, and as faculty and staff of this hospital, we are also very comfortable to run the OPDs in the new block.
Japan collaborates with civil societies that are key global health players working to strengthen regional communities. It addresses factors that could influence health, including climate change and antimicrobial resistance, or AMR. Furthermore, it will reinforce research and development capabilities and support the utilization of innovative technologies.
And also new technologies or innovations to reach out. For example, the cheap wearable, the disseminating to populations, and that will give all kind of monitoring, alerting, variety of health issues. And even for new pathogens, we could have new solutions. So I really expect that kind of new technologies and innovations prevailing and make our promise possible and also reachable.
Taking into consideration the fields of water and sanitation, education and nutrition, gender equality, and humanitarian crisis support, Japan will continue to pursue cross-sectoral approaches and multilateral initiatives. Japan will cooperate with the international community to achieve human security, where no one is left behind, and work to achieve more resilient, equitable, and sustainable universal health coverage.